Good morning, everyone.
Good morning.
Thank you for attending our career and family planning event. Can you have it all? I am Danielle Clark, here as a member of the program committee, and here to just welcome you. All right. We are here today to discover our options when it comes to family planning. Some of us have delayed our family planning to focus on our career and be career driven. And now we want to see what our options are, and that's what we'll inform you of today. All right. I would like to introduce you to our program committee chairperson, Jessica Hughes, who will be our moderator for this event today.
Hello, everyone. Good morning and happy Saturday. I know it's early on a Saturday morning, traffic, parking. So we appreciate you being here today to learn about this topic that is near and dear to a lot of people, whether they know it or not. So we'll just have a few slides and then we'll get right into our panel discussion. So the first thing is, why are we here? One, statistics say that we should be here. Statistics say that we should be thinking about family planning as opposed to simply just delaying family planning or saying it as an ad hoc whenever it happens due to a lot of different reasons. So statistics say that. Your career is important. Women, men, everyone's career is important because that's how you provide for yourself, how you find purpose, and all of those things. So your career is important too. Also, family planning is important. Those two things are important. So really, we are looking at the duality of those two things today. Fertility is essential to family planning, and that delay of career, which means you're aging, it can come with some risks, right? So we want to make sure that we explore and discuss those today. Next slide, please. So there are some statistics out there as to why women choose to delay children. If you can see, it's a little hard. The top reason is because they don't have enough money saved, right? Which is technically usually tied to career. Next up, we have, I want to earn a higher salary first, right? So this is saying, hey, look, I want to have children, I want to start some family planning, but I need to wait because I need money. And waiting, again, as you know, I think high risk age is 35 technically. So as you continue to progress in your career, it might take a while. It might take after 35. So women are wanting to do that. Traveling, we all like to travel. That doesn't have anything to do with this topic necessarily, but that is a reason. So these are statistics that we're looking at as we have this conversation today. Next slide, please. I thought these were some interesting findings. Here, again, black versus white women in motherhood. One of the things that I noticed when I was looking at statistics is the methodology around motherhood. And I'm looking at slides here because I can't see. But one of the things that it focuses on is intensive mothering for traditional white women, right? Intensive being there, being present, being maybe helicopter parent, right? That's what it looks like, that methodology. But as it pertains to black women, the key words that stood out was economic self-sufficiency, right? So a lot of women are having to serve that role compared to our white counterparts when they're intensive mothering. So if you're having to be more financially there, self-sufficient, then you might feel less obligated to think about family planning because of the financial constraints. So these are all reasons that women are, plus others, are delaying motherhood. So those are just the brief reasons of why we're here today. We also have 4 panelists here that are going to hopefully break down your different options as you explore family planning, and also just discuss some reasons why people delay those based on their experiences or what they've seen in their profession. So first, we're going to introduce a few panelists. So first, we have Dr. Tiffany Jones. So Dr. Tiffany Jones earned her medical degree from McCary Medical College in Nashville. She completed her residency at USC Medical Center in Los Angeles, and she completed a fellowship in reproductive endocrinology and infertility at Mayo Clinic in Rochester, Minnesota. So she is the recipient of many awards, and this is an area of expertise for her. And I'm excited to have her here. Is there anything you would like to add? I just want to give it up. Next we have Dr. Jatan Dorsey. Dr. Jatan Dorsey is an award-winning speaker and coach, adjunct professor, and four-time Amazon best-selling author. So you guys can go on Amazon and look for her after this. She has a master's and doctorate in business administration, and also she's a vice president in risk mortgage banking, and she's the founder of Wombs in Waiting, an organization created to raise awareness and build community and create support for those who experience infertility. Dr. Dorsey, would you like to add anything?
You handled it well.
Next we have Andrea Fowler. Andrea is a seasoned real estate professional who has a deep understanding of the real estate market here in North Texas. And she has over $50 million in sales to her credit. She opened the first Black-owned beauty supply store in Prosper, Noor Beauty Supply, in 2021. In her free time, she enjoys scouting, speakeasies, and DFW. We'll talk to her after this. Restaurants with great ambiance and traveling the world. Anything? Okay, I'm trying to give you guys the opportunity. Last but certainly not least, we have Brandy Watson, MBA. She's a vice president of HR business advisors at JP Morgan Chase Asset Wealth Management. She provides expert consultancy for human capital management, and she's strategic thought leader who conducts market research and provides expert opinion on employment retention. And she's here from an HR perspective, so we need to see what these jobs are doing and what they can be doing to support us along this journey.
Amen.
Thank you. So we're going to get right into the questions. The way that this is going to be set up today is that I have a series of questions that I'm going to ask the panelists, and either one or multiple of them can answer those questions. And once we hit about 12 o'clock, we're going to have open questions for you guys to ask. So if there's anything we didn't touch on, you guys can ask those questions. So this first question is to all the panelists. According to modern state infertility, 1 in 3 women claim wanting to reach a certain title as one of the major factors in delaying having children. How does this mindset impact family planning and the potential need for fertility treatment?
Hello.
So I would say the reason why it impacts kind of the idea around family planning is because we see a lot more women in the workforce being very focused on their careers and saying, I want to intentionally take a back seat to being a mother right now because I have time to do it later. But what happens is that mindset of, I have time to do it later, your body doesn't always necessarily capable or you haven't sufficiently prepared your body to be able to do it later. And so it's one of those things that, especially in the Black community, we don't have a lot of intentionality around being very purposeful on, well, what does that family structure look like from a future state perspective? And so, great for us to be out there, great entrepreneurs, we're like leading the industry in these numbers, but when we think about planning our families, we just don't have that same focus right now.
Yeah, so one thing that we're really not taught very well coming up about reproduction, except for don't have a baby with your right? And so I'm a product of a single mother who had me, or was pregnant with me when she was 16. And so ingrained in me was not to do that, not to follow that path. But then you get to 20, get to 30, and then that mindset really never changed. And then I am educated because I went to school for it, but I know I was never told that I was born with all of the eggs that I'm ever going to have. And that's a really powerful piece of knowledge abnormalities, so our miscarriage rates go up, infertility rates go up, and so as people are pushing birth control, which I'm OB-GYN, so I definitely believe in birth control, but we spend a lot of the focus on family planning and prevention, and then never get that talk about, hey, things are changing. We always say black don't crack. Those eggs didn't. It's a mindset that we really have to be purposeful in changing and having that knowledge and knowing when it's time to just take an assessment of ourselves.
Is this on? Yes. I think from the perspective of both ladies that just shared here, I think when we talk about Black families, it's taboo to not only talk about family building, but especially with other women in your family who may have had infertility. And that was something that became discoverable through my lived experience. So it was kind of like you felt alone, or you feel like you have the time because no one ever told you that they had a struggle. And so you kind of learn as you go, as they say, life be lifing. And when it shows up, you're like, okay, let me figure this thing out. I mean, I know, someone to talk to kind of encourage me through this. You feel like you don't have the answers and only your doctor can answer them. But once you start to open up and have your tight circle, and then you'll learn that, wait, my auntie had that, my cousin did this, and no one ever said this. So I'm not abnormal, for one. And I have a circle. I have some people that can support me through the process. So I think, to go back to your question and to kind of add to what the ladies had mentioned, it's taboo, and we then go into this state of not being intentional about that, and everything else becomes priority. We learn later.
And something that I would say happens a lot is that we are starting to not even just plan our families later, we're starting to get married later. And it's usually not even a title, more so than it is how you want to bring a family in. So I know as I've aged, my idea of what a family means to me has changed, just because I know, and I'm gonna say this just because it's how my thought process is. For me is, I have all of my life to be married. I don't have all of my life to have kids. So it's more so being very strategic on, as I get older, what does this really look like for me? Is it waiting for a husband when I'm 50 and might get married at 50, but I might can't have kids at 50? So it's like, what does those options look like? And I know you're gonna get further and I'll tell my story on what I did, but that's kind of how it was for me. It wasn't a title, more so than I haven't found that mate that I really wanted to be with. And it's one of those things where I'm glad I'm older, because you think back to the mates you had prior to, you're like, thank God I had kids. So as I get older, I think your choices of who you want to be with, who you want to grow families with changes. So it's kind of one of those things, it's just like, I don't need somebody to be perfect, but I just need somebody who I feel like I can function with. Yes.
Thank you. I think that what I heard here is that delaying that family planning can increase your chances of meeting some assistance, right? Because you are delaying that. So what also statistics show is that when we think about family planning, 35% of Black women family plan compared to 59% of white women. Now, we talked here about family, right? Not knowing, not having these conversations. What is the first step in family planning? Like, how do you even do that? What do you need to think about?
I can take a stab at it. I don't have the, specific and registered trademark to this, but I can tell you what the experience was for me. So from planning, it was always, to my fellow panelists' point earlier, it was always that I wanted to be married before I had a child. So whether I had the degree or not, I knew that that was one thing that I wanted, right? But as you continue to progress or matriculate through your career and through education and things of that sort, your plans change. So you have to make adjustments. So knowing that I did want to have children and not really knowing that I would have any issues, I just went about life. And so for a person that may be doing that or may have done that, maybe you know this as well, but I would say if you plan to have children, to start having these conversations with your doctor early. And even in that, for me, I knew that, and like you said earlier, I may be getting into my story, you may be getting into this later, but just having your regular annual exams, right? Things can come out of that, and you want to ask more questions. Like for me, it was identified that I had fibroids, but at the time, it wasn't significant, at least what the doctor was reporting to me. That these are not concerning. I have a lot of patients that still get pregnant with fibroids. Yours are minor, you have few. And so you just continue to go about life trusting that, right? But I would recommend that you ask your doctor these questions if you have any concerns. If you don't have concerns, there are several tests, and I'm sure I'll leave that to the medical doctor to talk about the tests. But there are several tests that you can take, and some are very painful. But you'll get your answers. So again, having those questions early and often, not being afraid to ask those questions, and then really driving home and being an advocate for your own health. Because sometimes we'll hear, like I said, for me, they told me that the fibroids wasn't a concern. But later, they became a concern. So had I had the knowledge and the wherewithal at the time, I would have pushed that harder. Do some more tests, tell me exactly what this means for me in my future.
And you touched on my next question. As you begin that family planning journey, what are some tests that you can take to make you more informed about your body and maybe some next steps that you need to take? I think this is Dr. Jones.
I'll take a stab at it. So, modern medicine is like just amazing. There are actually home kits that people can do that can give you a little bit of information into what's going on in your body. So usually people, when they come to me, they're like, well, I'm having regular periods. Yes, your period is a vital sign. Having regular periods is important, but it doesn't mean that fertility is not an issue. People in like 49 can have regular periods, but the eggs, because they've been there forever, they're usually not as viable or not viable at all. So some of the tests that we recommend doing that you can do with your OB-GYN, you can do with a fertility specialist like myself, or you can do at home with a kit. Modern Fertility is a company that will mail a kit to your home, a finger prick, and then you mail it back. The hormone is AMH, or anti-Mullerian hormone. It's very important because it's made by the ovary and specifically by the cells in the ovary that support the egg. So the more hormones someone has, it tells you a surrogate marker of how many eggs you have at some point. Modern Fertility also, and I don't work for them, okay? They don't pay me no points. So, but they will give you a breakdown of what that number means for you. So something that you can do privately and maybe a little less expensively, will give you some information. I will say the American College of Obstetrics and Gynecology does not recommend testing every woman for their AMH. I have mixed thoughts about that because I know that even if an AMH level is low, it doesn't mean someone's going to be infertile, right? Fertility is a test of trying. So if you're not trying to get pregnant, that's why you're not pregnant. But at least it gives you a marker saying, hey, I'm in the normal range or I'm in the abnormal range, and it gives you a place to go from. But it shouldn't take you off the deep end because it's low and now all hope is lost. So that's why it's a double-edged sword. But that is a really good test to tell you just something that is important. The other test is an ultrasound. For Black women, as you touched on, it's so important. We never get ultrasounds. We always get put on birth control pills. We have heavy bleeding, just try this. But fibroids happen in about 80 to 90% of us in our lifetime. Fibroids are a leading cause of fertility issues. So waiting until you're 35 to 40 to find out that you have this issue, we're really behind the ball. So an ultrasound, though it's not recommended with an annual, most of you guys have your annual pap smears and have never had an ultrasound, just an exam to feel your uterus. It's not enough. I would say an ultrasound would be helpful because you can look at the ovaries, you can count the follicles which hold the eggs and get a good marker of how many eggs are there in a month. And then you can also assess the uterus to say, hey, do I have fibroids? Not all fibroids have to be removed, but at least knowing them gives you the information that may be very, very valuable in the future. So those are two tests that are very easy to perform and are underperformed in us.
Thank you.
Oh, no, I was just saying, I think I learned probably like my mid to late 20s that I had fibroids, and when I had the issue with it, it was just a bad pain in my back that TMI I thought was just gas all day, and it was not going away. So finally, I ended up in ER in the middle of the night because the pain is just really bad, and that's when I found out I had fibroids. And the doctor that I had at the time, I hate to say this, but it's true. I had a white doctor in Flower Mound. And she was just like, oh no, you should be fine, you should be great. Yes, she's like, if you decide to have them out, you're gonna take your whole uterus out and put it back in. And I was like, something about that don't sound right. You know, and so it was at that moment I said, I need to find somebody who looked like me. And so that journey from there started for me just not knowing what it was. And just like you said, if you don't talk about it, people don't know about it. So when I mentioned in my group chat, hey, I have fibroids, guess who else had fibroids? My whole group chat. We talk about everything but that.
If we were to ask that question even in this room, how many women have dealt with fibroids? I would say a majority of this room would probably raise their hands. It's something we don't talk about.
Right. And so now I'm talking to my friends now, I'm just like, hey, you know you have fibroids, go the extra mile with your doctor. See if they've grown, because you don't want to get to the point where you're trying to have kids and we keep having these conversations and you're like, I had one friend in particular who's been trying for years and keep having issues, and I remember saying to another friend, I said, I bet you she has fibroid issues. But no one in this group wanted to listen to me about fibroids. They said 1 out of 4 women had fibroids, and it was 4 of us in the group, but everybody's making it, no, I think it was 2 out of 4, and everybody's making it like it was just me. So those conversations, even with your friends, just start having those, because we're all, well, in most cases, most women, we don't talk about it enough. So I'm always advocating to my friends, and even at my store, I have younger girls who work with me, and they're like in their late teens, early 20s, and they always say, oh, my cycles are really bad, or I'm having so much pain. I said, talk to your gynecologist. This is the time to start having those conversations, because a lot of these conversations get swept under the rug until we're ready to have kids, and then we realize we have problems.
Great, thank you. So now that we've talked about our options, I know that Dr. Jones provided some low-cost options. Sometimes it's not a low-cost option, ultrasound or additional tests or screenings that you need. We all know that medical issues or anything related to medical is very expensive. So, Brandy, can you let us know, are there anything that companies are doing to offset the cost of these fertility treatments or anything that someone may need?
Absolutely. What I would say is companies have taken note that people are waiting and want to have more family planning options. Benefits, and when you're looking at your benefits package, as you're like thinking about different employers that you're courting or that are courting you, have found that more employers are baking in a lot of family planning services. And if you hadn't had this conversation with me 10 years ago, I would say, family planning, you're gonna need to do that on your own and it's gonna be very expensive. That is no longer the case. Many of your employers are making in family service planning, and it's something that you should even be courageous enough to ask about, like, what do those packages look like? Because we are putting a lot of things out, and it's not just family planning, it is about how do we wanna help somebody freeze their eggs? How do we wanna help somebody that may be thinking about a sex change? Like, there are all kinds of benefits that are now covered that if you had asked me 10 years ago, it would have been unheard of. So there are some resources that your employer has. They don't always do a fantabulous job of letting you know that it is a benefit that is covered, but that doesn't mean that it isn't. And so making sure that you're kind of looking at some of those benefits and seeing how some of those things can be subsidized by your companies is going to be critically important.
Thank you. So it looks like that when we are looking for jobs, we need to ask about the benefits package and bring it up, because the more we bring it up, the more companies will be required to do it, right? So we talked about a few tests and what kind of the mindset. So now we want to go into the options, right, as far as family planning. One of the most relevant here, the 3, is IVF, egg freezing, and surrogacy. So first we're going to start talking about egg freezing. And we have 2 people here that are very knowledgeable of that, so Dr. Jones and Andrea. So one can give a personal perspective and more clinical perspective. So if you guys can, Dr. Jones, starting with you, can you explain to us what is egg freezing and what does the process look like from a clinical perspective? And Andrea, if you can give your personal perspective and what you experienced during the process.
So egg freezing is a way to preserve oocytes or an egg at the age at which they're taken out of the ovary. So one, you have to understand that yes, we ovulate 1 egg a month, but there are cohort of eggs that are available. So just like animals have like litters, we could have litters, we're just not made in that way. So egg freezing allows us to rescue that cohort and freeze those eggs for future use. We don't have an ideal age of when it's gonna be perfect to do, but the younger you do it, the better, because our eggs are most viable the younger that we are. The process actively takes about 2 weeks to do. Hormones have to be taken because the body makes enough hormone to release 1 egg. But freezing 1 egg is not enough. Usually, depending on the age, you want to freeze about 15 to 20 eggs to have a good success rate of when you use those eggs of having a live birth. So hormones are taken for 2 weeks. Those hormones are injections. I am afraid of needles, so that's why I like their injections. But they're like a diabetic needle. They're small, subcutaneous, so they go into the tummy. But you take them for 2 weeks, and you have to be monitored while you're taking those medications about every other day. So that can be pretty intense because people work, right? But the monitoring is very important because medications are adjusted by those ultrasounds that are done and by blood work that is done to make sure you're responding appropriately. To remove the eggs from the ovaries is a small procedure. It takes about 15 minutes to do. It is under anesthesia. A transvaginal ultrasound is done with a needle, and the needle just goes into the ovary and just removes the fluid that has the eggs, and then that's it. The eggs are frozen. They're frozen if they're mature, and they can be frozen for forever, so longer than we'll be around. I always tell women that this is a backup plan, right? When you come to freeze your eggs, you have to first know that you're not infertile, you're not trying, that's why you're not pregnant, so you may never need these eggs. But if you do happen to have struggles later on in life, or some people just have to understand that if you start having your first child at 39, your second child is 42. Your third child is 44. It becomes very, very difficult to have a larger family when you start later. And so then borrowing from your younger self may be very helpful. But the process, I've never done it, so we'll give it to somebody else to talk about that. But it can be a little intrusive for 2 weeks into a schedule, and then those injections. They don't hurt, but if you don't like needles, it's a process.
Yeah, I was gonna chime in really quick when you said that's it. No, that ain't it. All that she just described, imagine having to do that multiple times. For me, my story was doing that 7 times over the period of 6 years. I know you're gonna share yours, but I just wanted to tag on to that, that's all, and I'm glad she said, well, I haven't done it before. But it can be very intense, and then to your point about having the check-ins in between, just imagine going to your doctor every 2 days, as Dr. Tiffany mentioned, and you get news that's good, you get news that's bad, whatever that news is, that's the emotion that you're gonna leave with, and you have to go back and put on a different face for work. So just imagine having to go through that, and though it's not painful, it is a very heavy process emotionally.
So just to piggyback on that, so when we talk about egg freezing versus IVF, because I believe your journey was IVF, to avoid those things and doing things multiple times, that's why it's important to do it as young as you can. Because if you try to, and people come in, I've had people as old as 50 come in to freeze eggs. That process is very different. There are very few eggs and the viability is very different. So when people freeze eggs at 25, doing it once is probably more than enough because they may never need them. Doing it at 35, you may do it twice if you are someone who had less eggs at that time in your life. But doing it after that really becomes a difficult thing. And so that's why things like this, to help you understand, to set yourself up for success, to avoid some of those pitfalls are very important.
So just to give a little background from my story, it was more so like an insurance plan for me. So I don't know what the future may hold, but I don't want to be where I get older and I'm like, man, I wish I would have had kids, and then I can't. So for me, it was more so, let me start this journey now so I can always have a backup plan later. And when I went through it, I used Dr. Jones, and when I asked about the needle, she was like, I don't know, I don't do that. And I was like, well, thank you, that's comforting. She's like, I don't do needles, so I don't know if it's gonna hurt or not. You just let me know. And so it is a journey. Like it is. I did egg freezing last year. So we started the process, I think, January of last year. And my surgery was the first week of February, which was an ice storm. And I looked at Dr. Jones and I said, I'm not trying to do this again. Are we really gonna make it? Like, because it can be an emotional process and you have to go every other day. Now, what you did not tell me that I had an issue with was I did not know they was gonna draw blood every time I went. And I was like, I thought this was a one-time thing, not an every time I come here thing. So, which was great because when we were testing me, my eggs would never show up to really be seen. So having the blood work really helped to see what was happening with my body, because those things can happen. And I was, if I'm 35, 33 when I froze my eggs, and still after the conversation, we realized that I didn't have as many eggs, and when I froze them, I think we retrieved, one is retrieved 6 and 5 were mature. Which in that process means I need to really go back and have another one done, but because it's time journey, it's emotional, and I was telling Dr. Jones, I said, that's what you, yes, I said, we'll revisit this conversation next year, but right now, today, as I walk out of this surgery center, we ain't talking about it no more, we're done. But it is one of those things that people can definitely do, and for me, it was more so a backup plan. Like I want to go into it trying on my own first, but in case I can't, I at least know I have those eggs that I froze at 33 to help me throughout the process. Because I don't want to just say, oh, I'm young and I'll be okay. I don't want to have those options happen. So for me, it was an insurance backup plan for me.
Thank you for that explanation. So one of the factors that, again, is so important is cost. What are the costs associated with egg freezing? Or that you experienced, or?
I think I'll be honest. For me, I didn't think the egg freezer was super expensive. What's super expensive was the medicine. And when I had to go an extra day because I just had, my eggs weren't big enough to be taken out at that time, I was really hot about it because I'm like, you know how expensive that medicine is? You want me to get one more day of medicine. So that was pretty much the most expensive thing. And like you said, a lot of places cover it. You might have some companies that are cover the medicine but won't cover the procedures. So within me, I'm self-employed. So my insurance that I have, and even though I always ask when I'm looking for insurance plans, what does women's services look like? Like every time an insurance company will call me, and I'm self-employed, so I'm paying for it, what does it cost if I was to have a baby? Mind you, I'm not even trying to have a baby at that time, but I want to know because life happens. And so for me, I paid everything out of pocket. I was able to do, like Lending Club has a fertility loan. So you can definitely get fertility loans specifically for whatever you decide to do. And so just pretty much knowing those costs. But the main expensive thing was medicine. I think my medicine was like $6,000. It's really expensive.
Yeah, so, insurance can't cover it. I've had patients pay as little as $75 to freeze their eggs through Progeny. So if any of you have a company that, uses Progeny, please maximize your benefits because it's a very good coverage, for any type of fertility, that you may need. Egg freezing can range, including medications, between $12,000 to $20,000, depending on where you go. Our egg freezing is probably the lowest in the city because I'm the only Black doctor in the city, so I really try to make sure that I'm accessible, as well. But the medications we don't control, and they're the only things that we can do to get the eggs to grow. One of the medications is discounted for people who freeze eggs, so we try to use that discount. But yeah, it is an endeavor that can be expensive. What I want to make clear is it's the least expensive part of the process. The most expensive part is when you come back to use them, okay? So, freezing eggs is one thing, but then fertilizing them, growing them, and I just remember someone had made that comment saying, no one ever told me this, so let me tell you, it is the most expensive part of it, at that point. You won't need it.
So let's just hope you don't need them, right? You just at a natural way, get pregnant, right? So we talked about money, and then also brought up, Dr. Dorsey brought up was time, right? And coming in, but I guess all three of you did, coming in every other day. That's, I mean, I don't know about y'all's job, but my job, I'm like, well, every other day you need to go somewhere to a doctor. So, Brandy, do you have any recommendations on how to start having these conversations with HR or managers about the need to be out of work? You know, I know we have remote work, but a lot of people aren't or still need to be at a desk, right? So how do you recommend having those conversations about the need to be out to conduct these treatments?
I think that's important to start having the conversation with your management team to let them know, I am gonna need to be away for a period of time. I think that sometimes we find we're doing life, we're not kind of bringing our employer along with the idea that we are doing life, and then our employer's like, so, where are you? And we're like, why are you bothering me? I'm doing me, what do you mean, where am I? And it's like, well, you know, we have this job over here, we kind of like expect you to be there. And so I do think it's important, especially when you are kind of starting the process, to say, I'm going to be needing to take some time away. You do not have to get into the specificity of what you are doing. You can say, but it's going to look something like this, and it is going to be for us to do these treatments. Can I do something from a flex schedule perspective? Is there some flex time that I can utilize while I am away? So that you can start to prepare your employer for you may need to have ad hoc unavailability, but also so that one, they can plan for other workforce issues, but also know that there are a lot of ways that we can kind of code time and time that is available to do these things if we know we can offer that to you. But let's say you have that employer that is like, no, and I don't care, so come to work. We do also have HR, and those are HR resources that you can reach over to say, okay, I'm having a conversation with my manager, and these are the things that I'm trying to have done. I don't feel like we are on the same plane, we're going the same direction. Are there any other actual HR resources that are sitting out there? So then that HR can kind of be that bridge in the gap, because we are more closely connected to the policies, the procedures, and the actual things an employer or a business unit can offer. And sometimes a manager is in the business of managing the work you do, but not necessarily the policies and procedures that the company has. And so that is another thing that I would say you should probably reach into to make sure you have some connection with HR if you're not getting all of the answers you need from your direct manager. Fair enough?
Yeah. Thank you. So that's kind of all on egg freezing that we're gonna discuss. If you guys have any more questions, you guys can ask later. So the next topic is IVF. So egg freezing is kind of you being proactive, right? Trying to prepare yourself for the future. IVF is usually now, right? You might want to have a baby now. You want to try, right? Maybe if you've had issues conceiving, then you want to pursue that now. Dr. Jones and Dr. Dorsey, can you guys speak on, again, the clinical process and the personal process of going through those?
So the clinical process of IVF is the same as egg freezing, except for when the eggs are removed, you have to take it one step further to fertilize the eggs with the sperm source, which could be a partner, donor sperm, something I don't know if we'll talk about, but we definitely should as single moms by choice, okay? So, embryos are made, embryos are then cultured in a lab. Embryos can be genetically tested, or they can be transferred back into the uterus or the womb for pregnancy. And also they can be frozen for future use. So that process of egg freezing, coming in every other day, again, especially when there's identifiable source of infertility, yes, that journey is a lot different, because it is an emotional roller coaster, because it's not just, I don't know when I wanna be a mom, it's like, I wanna be a mom 2 years ago, and now I'm having to come in here every other day, and you know, stuff is going on. So it's a lot more challenging than egg freezing cycle, but I'll let the panelists talk about that.
Ooh, how long y'all got? Sound like my dad as a preacher, but I won't keep y'all too long.
2 minutes, man.
So I guess what triggered my journey was a miscarriage. Ironically so, just before I got married, we knew we wanted children, and folks, you know how y'all do. When people get married, you already, when you get married, as soon as you get married, when you have kids. And so our response before we got married, 3 months prior to, we were like, we are 3 months negative, 3 negative months pregnant. Turns out that happened, and ended up having a miscarriage. And that kind of is what triggered my process. So through the miscarriage, it was like, oh, a light bulb went off. There may be some things I need to check, and as I mentioned earlier, I knew I had the fibroids, but I was always told that they weren't an issue. And so at this point, I'm like, okay, I know y'all think I'm about 20, so I'm gonna tell you, I started it when I was about 37. So the process, as I mentioned earlier, has been like over 7 years. But throughout that process, as Dr. Jones mentioned, like when you have your appointments and you're going in for those 2 weeks or whatever, you have so many hurry up and waits in between. So though you get your eggs extracted, you could get 20 eggs. However, by the end of the day, they call you and say, oh, actually, we only got 2. And then if you only have 2, then you send them for PGS testing. Again, as Dr. Tiffany mentioned, you have to hope and pray that those come back normal, not abnormal. And so that could decrease your numbers again. So it's just so many different phases of the process that you have to kind of be patient with and just, work through. But I'll say for me, we had the option of doing a fresh transfer. So you can either do that right as you extract and then do the fertilization with the sperm. You can freshly insert to obtain or to conceive. Or you can freeze them and you can keep them frozen just like the eggs as long as you want to, but there's a fee, of course, right? So depending on how many embryos you have successfully stored up, you can continue to do your cycles as often as you want. But even in the process of doing the stimulation, those shots that she mentioned as well, there could be times when the doctor may say your stimulation is not improving as we need it to be. Your eggs are not maturing, so this is probably not going to be beneficial. So hey, we need to stop this cycle, and then you've missed out on that medicine, and so you have to start over, which means paying for that same stuff all over again. And so I just wanted to paint that picture because it may not always be a clear cut and dry path to this as you experience it, but that was kind of high level without me getting deep.
And can I just say, success rates for IVF at 42 are less than 5%, right? And so that's like, if I have a bag of tricks, that's the deep in the bag, that's all I got. And so that's why I really want the point to be driven home that, assessing yourself, starting as early as you can, and then some people, even at 20, may run out of eggs. Primary ovarian insufficiency is something that people have early menopause. So just that is not all of us are going to be lucky, but some of us really can do the best for ourselves to just take that assessment as early as possible. Because once age becomes a factor, it's the one thing I have no treatment. We have no way to reverse the biological clock in that way.
Thank you for explaining that. Just like we did for egg freezing, can you explain the cost associated with 1 round of IVF? Just 1 round, not multiple, and we have to multiply.
Well, as she mentioned, with egg freezing, it could be 20,000, right? So it could be up to 50,000. I don't know how
That's
y'all
for 1 round?
I don't know how y'all math is mathing and how many times I told you I had to do it. And then I know you mentioned some coverage, but not all companies cover everything. So it was a blessing that we could financially afford it, but not everybody can. That's a taxing situation. So yeah, around about that.
So I will say that there are probably 15 fertility clinics in DFW. So in California there's like 80, but in some places there are like 1 or none. So while people are doing this journey, finding the doctor that they trust, I always encourage my patients to make sure that they, you know, if this is not what you can do, don't let the financial thing be the barrier. Go to another source. Some of my patients have gotten a job at Starbucks because they got good benefits. I almost got a job at Comcast. But I don't want to take those objections. But, you know, like you have to, you know, use your HR. Resolve.org is a very great fertility organization that can help you talk to your HR or train you how to and where to find benefits, what companies have benefits. So that's a good resource. But even if it's like, oh yeah, you like me, I'm like, yeah, but I may be out of network. And if this is going to be the end all be all finances, you have to, you know, use that because the medications are expensive. You may have to do things multiple times. But you know, we are resourceful people, you know, so just don't let that be a stop to anything that you want to do in any aspect of your life.
And I think you make a good point about, you know, checking with the doctor to make sure that they're in network. That was something else I ran into. Again, just not knowing. So, and I had built a great relationship with the doctor, loved him, great bedside manners, everything. And then the insurance said that he's out of network. So then I had to start over with another doctor and rebuild the process, you know, the relationship. And now I'm feeling like I don't get this warm and fuzzy from you, but you covered on my insurance situation. So yeah, it was a good point.
Thank you. So before we talk about surrogacy, which is our last option that we're going to discuss, I do want to ask a question about men. So we're talking about women and infertility and challenges. What are our options if the man is the reason why there's no conception? What does that look like?
So men can contribute to fertility issues about 40% of the time. So when people decide to have to conceive, one is if you're under the age of 35 and you've been trying for a year, you need to seek some evaluation. I'm not saying you have to have treatment, but I'm saying you have to have an evaluation because 1 year turns to 2 years, and then I have people come to me and we've been trying for 10 years. Well, wait a minute, you know, like it's too long. And then you're wasting time, valuable time, because again, the most important thing to take home is age is a factor we cannot change. So if it's less than 35, it's a year. If it's over 35, it's 6 months before you get an evaluation. And that evaluation, if there is a male partner, must include the male partner. I don't care that he already has a child. That's what I always hear. Y'all men in the audience, I mean, come on now. Y'all never want to do this semen analysis. And after everything a woman has to endure for these fertility evaluations, you know, the most painful one is the HSG, which we didn't talk about to check the fallopian tubes. The semen analysis is actually almost pleasant to perform. So, you know, comes with a big O at the end. So, you know, it just, it is the one thing that drags on every consult that I have because the males usually are just, you know, lagging. But 40% is a big number, so I can't tell you what's going on and if I don't have the full picture. Even if someone has kids, women will have kids, and miscarriages can happen, infertility, secondary infertility can happen. So yes, semen analysis is like the only thing I usually need from a man. And if there is an issue, it's not that we can't address it and fix it. There are male fertility specialists and urologists that can prescribe treatments. Some of the treatments that women are prescribed work in men because we have the same pituitary gonadal axis, which are the same hormones, so the medications can work. Sometimes IVF is the only option because of a male factor, because the sperm are either trapped in the testicle and can't come out, or they're too low. But I would definitely encourage a semen analysis for a couple if there is a male partner.
Thank you for that. I just want to make sure we talk about the men a little today. So the last topic that we're going to cover is surrogacy. Honestly, I don't know anyone who's done surrogacy. I've never, besides TV, right? Shows and things like that. So rich people, right? So, you know, that's not for us. I don't know if in the Black community if there's a lot of talk about surrogacy, right? It's like either you have a baby or you don't. Really, no one talks about fertility, no one talks about all these issues. It's just, hey, if you can't have a kid, you can't. But we talked about a few options, but I do want to touch on this one, probably because it's so rare in our community. So Dr. Dorsey, do you mind talking about your experience and what led you and your husband to go down that journey?
Well, I think I told y'all what led me. No
We
seven
know
tries,
that.
no.
Specifically
But-
surrogacy, because that's a rare journey.
Yeah. So, after collecting our embryos, getting them tested, because after you pay all that money, you're like, let me go ahead and take this extra step to get them tested so that that's out of the way. That's not a concern as far as the embryos. So they're frozen. I tried a few of them. I actually had 2 fibroid surgeries. One was a robotic surgery. And I went that route because that option was promising a quicker recovery. However, it wasn't successful, so I tried the full-blown fibroid surgery as well. So once I had the unsuccessful implantation, at least twice, I didn't want to exhaust the embryos I had and have to backtrack and do all of that again, right? So at that point, we're like, what are our options? Thank God we have embryos, thank God it's both of us, okay, what's next? And this is how we went about this process, and so that is when surrogacy came up. But even for me, I had to look into that. What does this really mean? I didn't know anyone had done it. How much does this cost and everything? So looking into it, we decided that that was a good avenue. Initially, we were hopeful that we would find someone that we knew, we liked, we trusted, we loved. We did find a couple of people that, I say find, they actually raised their hand after they knew the story, but it was a very tight circle, so not too many people knew of the struggle at the time. Sometimes you want to heal and deal before you share. And so after going through that and attempting to utilize those folks that were nice enough and kind enough, I don't even know if that word is big enough to describe the heart that you have to do such a thing. But it didn't work out, so for many reasons. They have to do testing with your OBGYN, with your fertility doctor, and if you go through an agency, they also have to do testing through an agency, which is, I'm all for that because I want you to be safe, I want you to be healthy before I implant my embryo with you as well. So you have all those checks and balances before you even get into the process. And so we decided to go through an agency, and I know you're gonna ask about the cost, so I might as well put that in there. Surrogacy could cost from $120 to $250. $150, comma. Okay.
Not dollars.
So it depends on if you go through an agency as well. Again, we went through an agency. You would have to pay the agency plus you paying the surrogacy, right, or the surrogate. And in that, you're also paying for that surrogate's medical bills, her appointments. If she has to miss work, you have to pay for her income for that day. I mean, there's a lot of things that are entailed in that. And, you have a legal contract. You have both sides have to do counseling. So there's a lot of phases that go into that. This whole process could take at least a year before you get to the point of even being able to implant, because you have to go through the legalities and things of that sort. And you set up an escrow account to where you're able to pay out the income as needed to the surrogate. And so, again, we're learning this as we're going because we didn't know anyone that had done it. And then after, the successful implantation, leading up to that surrogate is likely going to go to your fertility doctor. But once she's confirmed as pregnant, then she can transfer to her doctor. But you have your agreement with that surrogate as far as if you can attend the appointments, if she's okay with you taking pictures, things of that sort. It's all in the contract. So everything is discussed and agreed upon legally. So I'll pause there to see if there's more, because I got plenty.
My next question was about the legal ramifications of this, because of course, you see movies about people having surrogates and then they say, oh, I'm keeping this baby.
Yes.
So what are the legal processes involved in that to ensure that when this baby is delivered, it is handed to you,
Yeah.
he or she?
So they can certainly change their mind, but that doesn't mean legally that they can take the baby. And so that's the point of having the attorney. And you typically have an attorney that's on your side, and then an attorney, you have to pay for a separate attorney for them. So there's no conflict of interest. Yes, so the numbers are adding up, right? And so they have to review the contracts on both sides. There may be some back and forth, some references to, what the attorney thinks is not in your benefit. And then you have to go back to the drawing board and make edits as necessary. But yeah, they can change their mind, but in the contract, it's typically clearly outlined that they can't even travel during this time. Or, you know, you can only go so many miles from where you live. So those are things that can be included in the contract. And, thankfully, my surrogate, she was like, she already had 3 children. So that's another thing. Typically with an agency, a lot of the women have already done it before. And so this was actually my surrogate's first time. But those are some things that you can look into. You let the agency know what it is that you'd like to see in your surrogate. So it could be, you know, age, ethnicity, where they live. It could be any type of detail that you want them to consider as they look through their roster. And then you I've never been on a dating site, but I assume this is similar because once you send that information over, then they'll send to you profiles of folks that kind of align with what you desire. And then you have sessions, you have meetings with them, you have a chat, you just kind of have coffee, have tea, or whatever it is. Ask the questions that you want to ask, and after that call, you just let them know, hey, we both want to proceed. And if that's the case, then that's when the ball starts rolling.
Thank you. So as far as like the hospital, when the child is born, are you allowed to be in the room and a part of that process?
That's in the contract as well, and then there will be a separate discussion prior to the birth, where you outline both sides, again, outline what they would like to do or be a part of during that process. So in my case, she wanted me to be in the room. I was there, I was able to take pictures, I was there the whole time. So I even cut the umbilical cord. So it just depends on what everybody agrees upon and how comfortable they are. Because even for me, taking pictures, I'm like, she said I could and she wanted me to, but I'm like, if that was me, you know, I have to keep that in mind because it is a sacred space. So it was awesome. But one thing I will say too is, again, back to my earlier point when I said just keeping your circle tight as you're going through the process and knowing people that you can trust with the story, right? So we didn't even share this publicly really until my baby was born, actually the day after she was born. And I had to explain it to your point earlier because we don't know what this means. So some people were like responsive, oh, congratulations, wait, I didn't know you were pregnant, what had happened? Or, you know, oh, congratulations, you adopted. No, this is not adoption. And so the analogy I like to use is that if you think about it being invited to a potluck and you were assigned a cake, you can mix your ingredients at home and you can take it to that person's house and put it in their oven. Or you can mix it at home, put it in your oven and take it over baked. Or you can go to the store and just buy the cake. So that's adoption, that's surrogacy, and that's IVF, right? So then they got it like, oh, okay, I get it. So it's your embryo, but it's just her oven.
That's a great analogy. Thank you. Go ahead.
One thing I was gonna say on the surrogacy journey, and hats off to both of you ladies because I know that it's a lot to get up and talk about these things, but I think we definitely need to hear these conversations more. How often do you see in that menu or that flip book or that Tinder or surrogacy app black faces and brown faces that are out there willing to be surrogates? And was that a part of your decision making?
No, they actually don't give you like a database per se. So you just send over what it is that you would like to see in your surrogate, as I mentioned, and they just come back with some profiles. So you'll see a picture and some information about that person. So they may send over 6 or so profiles for you to review, and if you like them, you like them. If you don't, you don't. You can meet with all of them and then decide, but it's not like they just give you access to a database and you can just flip through. But at the time, ethnicity wasn't a concern. So we did have a Caucasian lady initially that we had connected with, and it was working out. But yeah, I think it's more.
That's a great question. Thank you. So we have 2 more questions as we have to wrap up. I did want to touch on this because Dr. Jones mentioned it, and it was on my list as a possible question. What should women think about as they're pursuing their career? They want children, but they do not have a prospective mate. What is something they should think about?
So when I have these conversations, which are really, really intimate, right? And I think one thing you have to know that maybe your OB has never broached the subject because it is so intimate, and sometimes people can take offense to it, right? Like, because it's like, well, when are you gonna have a baby? And it's like, none of your business. But the business of it is that again, the age, falling back on the age thing and just making sure that we're helping you, cultivate this one life that you're given, right? And we know the pitfalls. If someone comes to me that they're wanting to freeze eggs, I sit them down and I say, okay, but when are you desiring to have a baby? And if it's now and it's just because I don't have a partner, the conversation has to include using donor sperm, right? We talk about no black surrogates, ain't no black donors either. They're fewer and far between, and I don't really have all the answers of why, but I feel like conversations like this will at least let people know that there are options. And if someone is generous enough to do something like being a surrogate or an egg donor or sperm donor, these conversations let them know that it's possible. But the reason I connect being a single mom by choice with being someone who wants to freeze their eggs is because, delaying is, definitely something that you can do. But really, when you're looking at a backup plan, you have to know that when you thaw these eggs, they may never make embryos. And so the true way to preserve your fertility is to have a baby, right? And so if that's something that a woman is wanting to do, then knowing that that's an option, that she can do it alone if she so chooses. That's not everyone's choice. Everything is not for everyone. But I'm a firm believer, if you don't know your options, you are not making an informed decision about anything. So choosing to be a single mom by choice, you can do inseminations, because again, someone is not infertile unless they're not trying. You can do an IVF process and make embryos, and you'll decide to use them now or use them later. If someone wants to be a mom and there's no partner, there is an avenue to do that. It's a lot of work, but some of us end up being single moms, and that wasn't the choice anyway. So, just to let you know, there are options.
Thank you. So now we want to open up to the audience to ask a few questions. We're going to use my mic. I think we're short on the mic. So
I'm gonna say something about surrogacy.
yes, please.
I don't know if anybody watches Married to Medicine, but I love reality TV. So Dr. Jackie in Atlanta actually opened up a Black surrogacy agency. When we first started talking about surrogacy, the first thing was like celebrities, and this is what they do, but this is not what surrogacy is for. You actually have to have a medical indication to use a surrogate. So whether it's fibroids, you've had multiple failed, some people have had hysterectomies because of whatever reason, are born without a uterus, or have a cardiac condition where they can't carry a child safely. So those are some of the indications. And some companies pay for all of it. The most inexpensive way to use it, and we use the term surrogate, but the true term is gestational carrier. The surrogate in the olden days was someone, it was their egg and then the partner's sperm and their uterus. So we do not do that, because that becomes very complicated, because there would be a genetic link between the person carrying and the egg, the embryo. So a gestational carrier now is not linked at all. So it would be very difficult legally for them to claim that child, even though they did help to carry it, but it is not genetically linked to them.
Thank you for clarifying. So now we'll get to questions. Kavindra has the mic in the back. If you have a question, please raise your hand and she'll bring it to you. And please state your name when you're asking the question.
Hi, well, I'm Tosin. Thank you all for sharing your stories, and thank you to the doctors. So I actually went through the process for egg freezing. I'm like 2 weeks out, so for egg freezing. And I did, what everyone says, they do it young. My retrieval was before my 27th birthday. But still, like you, I didn't get as much as I wanted. During the process though, I did find out there were supplements that can help, right? Like they improve like your egg quality, maybe not increase the quality, but could help you. Are there some things that you could share? Because I know we're starting from the egg freezing stage, but look for that right away, how can you think about maybe taking some of these supplements to increase your chances, or just make sure that when you're doing it, you're better positioned, right, to get what you're looking for?
That's an excellent question. So, remember I said we cannot give you more eggs. So, but supporting the eggs that we have and improving quality is definitely something we try to do with supplements. So CoQ10, omega fatty acids, antioxidants are very helpful because we feel as though the DNA damage that happens to eggs that cause their quality to decrease over time is due to free radicals. So antioxidants, in essence, would help. Of course, leading a healthy lifestyle, decreasing weight, increasing activity, those all have very positive effects on fertility. Not smoking, I don't know anybody who smokes now, so I hope nobody in the audience smokes, but that is one way to surely expedite ovarian aging. So that would be something that is controllable, that can help improve outcomes. Because again, when you do it, you really want to do it just one time, and you really want those eggs to give what they are supposed to give, which is a live birth, if you ever need them.
I just want to ask a question because I know the culture here, you mentioned smoking. Does hookah count with that?
Somebody invited me, I was like, I am not in your hair, your clothes, yes.
Everywhere.
Now you're gonna live your life, but when it's things, especially when you're gonna spend this kind of coin, you wanna put your best foot forward. So, it's not good for eggs, and it is very well studied.
Thank you.
Vaping.
Vaping. Yeah, because people separate those, right? People say don't smoke cigarettes, but hookah, vaping, all those things can have issues. So I just want to, though I was joking, it's a really serious question because people don't look at them the same.
I know, like for me, I want to do a second round of freezing my eggs as well because I don't think I had as many as I wanted to give. But the process was just taxing, and I was just like, give me some time. But something that I want to do when I go back and do it the next time is more so lose weight and get my body in a better shape so that I have the options to freeze more, or just even that round only had 6, so if I were mature. So it's like and I forgot how many you told me could really become a child in the future, but it wasn't a high percentage for me. And I'm just like, well, dang, I done spent all this time and this is all we got. But also, that's my case. So when I go back for my second round, I want to be in the best shape that I can be. Now, if it still happens to be what it is, I can accept that. But I know this first go round, it was more so, let me just do this process and let me get through it.
Just so we know, because these are hormone injections, weight will more distribute the medication. So that's why having a lower BMI can be helpful, because again, the medications they are expensive. So using the lowest dose would be better than using a higher dose, because you would save money on that. But I will say that for me, for our clinic, our BMI cutoffs are 50, right? And Black women, we are, like BMI is very different for us, and so I never would want to discourage anyone at a different weight, because I've had people who are turned away at other clinics and make beautiful embryos and have beautiful pregnancies and babies and things like that. But, the science is a science, and so, if you want to save, coinage, if you want to potentially have more eggs from that, then yes, losing weight can be helpful, but it is not the end all be all either.
Thank you, ladies, so much for your honesty, transparency, and wisdom. We really appreciate it. My name is Sarah. I'm the lead fitness trainer and nutrition coach at Sarah Jane Fitness. You mentioned health, and I work with women, helping them eat better and exercise. I had a client who just got married at 39. She is overweight, high 40 plus BMI, wanted to lose about 100 pounds and wanted to have a baby within the next year. And so, you know, the task on that. And so she was telling me that her doctor was letting her know that probably right now is probably not a good time for you to start considering, you know, having a child because of your weight and the process of delivery and all that stuff. So we've been working on that. My question is, are there any, we know health is important, we know losing weight and exercise is important. You just mentioned decreasing the dosage because of your BMI. Are there any conditions that we aren't aware of that is directly affected with the mother or the mother-to-be because of her health, or because of her weight, because of her inability to exercise that can be avoided other than preeclampsia or diabetes or anything like that? Or is there anything else that we're unaware of?
Miscarriage rates can be higher in women overweight. Again, I want to say that when you told me the story, the first thing I'm like is, because 39, right? I want to lose 100 pounds. It takes a lot of time, right? And so if I had to put BMI versus age, I would take a BMI that's higher over an age that's higher any day. Because we can lose the weight, but once those embryos don't give me embryos anymore, then we're talking about donor eggs. So for anyone, like I said, yeah, there are complications, but I've had patients with low BMIs have complications too, right? So I don't put the stock in the BMI. We know that being the healthiest, it can improve things, but nothing is gonna change that age. So starting that journey 100 pounds lighter at 42 is not going to help her.
Turn the mic on.
Hey, good afternoon. And I just want to say thank you so much for sharing your experience, personal and professional, because that really does help all of us in our own family planning decisions. My name is Nicole, and the question that I have is pretty much tied to the financial aspect of it, because I know we talked about how a lot of employers, that some of them do pay for a portion or even all of like the egg freezing and the idea. But I want to know, is there any resources in regards to grants or scholarships or additional funding that one can do as far as research to see if that's an option for them, if their employer does not pay for it?
Yeah, so resolve.org has a list of grants. Baby Quest Grants is some grant agency that gives out maybe $15,000 to $20,000 per couple. I think they do it like maybe 2 or 3 times a year. Different states, different organizations, even some clinics have their own grants. I haven't come across anything for egg freezing except for if a person has cancer. And so people who have breast cancer or ovarian cancer, uterine cancer, colon cancer, anything, they can get grants to freeze eggs before chemotherapy, because chemotherapy damages DNA, it will damage the eggs and potentially make them infertile once they get on the other side of cancer. So egg freezing, no, but fertility, yes, can be very competitive. But there's a list on resolve.org.
Hi, again, thank you guys. You guys have been spectacular. I've learned some stuff that I didn't know. I mean, you can know. Anyway, one thing I want to say, and I'm older, a lot, but everybody in this room, male and female, I know there are discussions that Black people don't have. Where I grew up, when I grew up, having a baby, 100%. You just did or you didn't. It never occurred to me to plan it. It never occurred to me that maybe I don't want to have a baby right now with some guy that I kind of like. Talk to your aunties, your mamas, your cousins, your neighbors if you're close. Talk to them about fertility issues. Talk to them about, hey, if you had thought about it before you had me and Junior and Sally and Mary, would you have like continued on the route that you went, or would you have thought about it a little bit more? Talk to me, tell me what you think might be a good idea for me to do at this point. And guys, especially, with girls you don't even like, guess what? You can end up stuck to her. So, girls, we have a choice. We can say yeah or nay. Guys, you can't. You get a phone call in 12 years like, hey, remember me? You don't want to do that. But anyway, just everybody, just have some conversations because it's been opened up now. These ladies have opened up some stuff for us to go work with. It's open. Go and talk to somebody about what's going on tomorrow. Because it's your life. Just do it right if you can.
Thank you, Mama. I appreciate you, Mama. Can everybody give my mama a round of applause?
I'm just gonna piggyback on that because it's really important. And then the way we have these conversations is really, really important because in our community, like we Jones a lot, we just, you can really cut someone deep with not having the empathy to understand. I can only imagine the journey that you went through and keeping your circle tight and the reason you wanted to do it because you knew, some people have all these critiques and criticism. Just pray about it. Just, and it's just like going through that, is so difficult. So another point to take away is when you're having these conversations, you don't know someone's struggle. You don't know how 7 IVF cycles. I mean, most people don't get there because they get so defeated. And not having people to support them, or even just, that person that's sitting next to you, just that wants to make that little comment. It's like, keep those comments, come with grace and love and just empathy. And some opinions may not be necessary because it can be really hurtful. The reason why we don't talk about surrogacy because Lord knows the criticism that would come. Why you didn't, and it's just like trust and believe it was tried. And I see those broken people sitting across from me and it just is so hurtful. So as Black people, we really just have to have that empathy for each other to know even if it's not a journey we would have chosen, we don't have all that information and sometimes we have to come from a place of love.
And I want to just speak back what you said, just talking to family members. I think before I started my fertility treatment, I went to my grandma and I started asking questions. And I started realizing a lot of them have had fibroid surgeries. That wasn't new for anybody. And I was telling her about me going into fertility. And of course, my grandma's a woman of a certain age. And she was like, girl, I wouldn't spend all that money. I was just going to get pregnant and call it a day. That was her thing. She was like, how much it costs? I don't know if I'm gonna be able to do that. I think you should just go get pregnant. The things they tell you in your 30s is way different than they tell you in your 20s. And the whole thing for me is my mom had a full hysterectomy at 35. So in my head, for my 30s, in my head it's always been I only have until 35 to really have a kid. And so that had been in my head for years in that thought process that my mom at 35 could no longer have any more kids who struggle having me because of fibroid issues. So I started calling my mom and my grandma and then my mom's sisters, where I found out one of my mom's sisters never had those issues, and she actually had her first kid at 30. And so when I talked to her, which surprisingly, she's only 3 years older than my mom, but she was just like, yeah, that's like a good option you should do. And plenty of women in our family have had kids in their 30s. And she started naming them. And she was like, well, some of them was way too old to do it, but they did it anyway. That was a conversation between me and her, though. She was just like, but they had them anyway. So she was like, don't think that you cannot have kids in your 30s. Because that's what my mind was, is 30s in my family, I have not seen it. Everyone had kids as teens or in their 20s. And she was like, no, I had both of my kids in my 30s. And then this aunt had a kid at 39 and that aunt had a kid at 40. So it gave me a refresher or made me feel better about having kids in my 30s because I didn't think that anyone had did it. So just having those conversations and talking to different people in your family, you'd be surprised what they've been through that people just do not talk about.
Hi, thank you so much, ladies, for sharing your stories and all of that. Fun fact, my mother had me when she was 45, so there's that. So I know we talked a lot about the child-making process, especially and the options we have. I kind of like to circle all the way back to the beginning of some of the reasons people don't women don't make children is kind of because they're focusing on their career, or they feel like they're not financially ready, or they might not have a partner yet. So my question to you ladies is, when you were going through the decision-making process, like it can be very overwhelming. Did you just go onto Google and start typing a bunch of things? Like what was your research methodology to look at what decision would be right for you? And second part of the question is more for the HR. Do you see women's careers stalled if they have children early or like in the middle of the career or in the beginning of their career?
I'm gonna I answer that one first. And so I do think that there is a stigma associated with women in the workforce where, okay, are you really serious about getting to the C-suite if you're taking time away and you're focusing on other things? I have seen some trends really start to shift that perspective, that the reality of it is that women are just as capable of sitting in seats at the C-suite, regardless of if they are primary caregivers. I see a lot of role change and role expansion in what family dynamics looks like, meaning that I see some women that are top executives where their husbands are more of the primary caregiver for the children. And so those dynamics have started to change. I do think that it is something to take consideration of the time that you will have away and how far and fast after your career you want to go when you do decide to expand your family, because there is potentially a division of focus that may happen when the child gets here that may have not been there before, that you'll just have to kind of prepare yourself for and have some consideration around, depending on how hard you want to go after your career. Where I've seen women be very successful is having good systems, resources, and villages around them. And that has given them the opportunity to spread their wings and continue to excel and go to the highest levels of their career at times. So hopefully that's helpful.
I think when you were like about the research part, I think it's just having conversations with my friends. Like we were all like early 30s, mid 30s, and everyone wasn't getting pregnant easily. So then it became a conversation of what all should we be doing now if that's something that we want to do. And so that's kind of where the research started. And also just having great doctors. Like for instance, when I went to do my fibroid surgery, my GYN at the time was the one who suggested Dr. Jones to me. And so them two together did my fibroid surgery. Then the question came back, okay, now that I've had this done, what else should I do? You know, I think I want kids, but I'm not necessarily there just yet. But what should I be doing right now to give myself that option? And then having conversations with friends that were married who were struggling to have kids just made me feel like, okay, let me prepare myself now instead of waiting. And sharing those different conversations become a thing. But you also have to be someone that people feel like they can trust to have that information with. Because some people just do not have that conversation, so it becomes very taboo, especially in our culture.
We're gonna have 2 more questions because we're gonna stay almost true to time. We started a couple minutes late.
Hey, how's it going? My name is Mark. I have a 2-part question. First question was around, you see over the years, a lot of women have moved over to be entrepreneurs, in corporate America, or not being paid well, not moving up the corporate ladder. So I wanted to know, you talked about some statistics and data early in the presentation. Can you talk about, does family planning change the data and statistics from women who are entrepreneurs versus who are in corporate America still? And then the second part of the question was around, you guys talked a lot about physical health, medical health, but not a lot about financial health. So how important is it for women to start doing financial plans? Not only talking about going through the different medical things, but also when the baby comes, being prepared financially to give them a quality of life with you and your kids as well. I talk about finance because I'm a financial consultant, so I don't know what's important. So. And kind of building up a budget.
I think you have beautiful financial questions, and most of that don't have the answer for you, being honest. But I would say, when you think about those that are really considering kind of the family planning aspects of it, having a strong financial foundation is going to be critically important, and that's going to be in some of the things that the ladies on the panel have already discussed as far as how much it costs to get these things done. It didn't sound like anyone was able to offer a $5 option for us to have. And so, well, 75. So kind of being very thoughtful about what that means and building a plan around that to be successful for the things that you're going to do, I think is going to be just a part of your building blocks. Of course, after it's all said and done and you've gone down the path, making sure you're building for the future is just going to be important. And I think that that's just good hygiene that we should all practice. But I don't have statistics on what would be different from an entrepreneur versus women that are in the corporate sector on what those specific rates are, but I think it's a good data point that I can kind of look up and I can circle back with Jessica later and maybe email out to the team. Fair enough?
And I would like to add, based on some research that I was doing, is that one of the things that we're talking about as far as financial, especially with entrepreneurs, is the time off, right? After having a baby, after conception and giving birth, right? A lot of companies, which a lot of them don't, may have maternity or paternity leave options, but as an entrepreneur, you really don't have that option, so you have to do a lot more saving and planning for that. And also, they kind of get that same recommendation to people who work for companies who do not have a paternity or maternity leave program. So not only are you saving and investing money to prepare for the process of, hopefully conceiving, but also of taking care of your child. In addition to that, the resources that you might need, if you want to be in the C-suite or somewhere, right? You're gonna have to have resources. You're gonna have people, maybe a nanny, maybe someone there. So I think financial planning and family planning go hand in hand.
I'll just speak from my thought process as someone who is an entrepreneur. It's a little bit different. Like the health insurance is not the same for me being self-employed as it would for someone who actually works with an employer. So the finances of everything is always planned out, always has to be well thought of for me. But also, like you said, knowing that I am an entrepreneur, so the income can be unlimited if I want it to be. So it just depends on how much I want to work at it. But something else that also takes in mind is that if I'm not able to do something, then I can't make the income. So therefore, the planning of just financially where you're gonna go, where you're trying to be is an important step, especially for someone like me. And also other things that I've thought about, because my family, I'm not from Dallas, so if I was to have a child tomorrow, there would be extra resources I would have to take into. And something that I've been thinking about, I might say the word wrong, it's pretty much like a live-in nanny, that type of thing. Thank you. I'm like, it starts with an A. So that's something I really considered, just to have someone in-house with me to help me go through everything. Because my mom, yes, she can come from Louisiana, but it's also my mom being in my house all day long. That I'd rather just pay somebody else. But I know my mom, I would just rather pay somebody else. Yeah, I'm gonna have to. I'll be like, well, so when are you going back to Louisiana? But no, so those are the thought processes that as someone who's entrepreneurial and who does not have a husband in sight, those are the things that you have to think about, like what are those costs gonna look like? So that's just something to plan for an entrepreneurial person to say, are you looking to have a family? What does that look like for you? Have you started planning that out? Because it's gonna be a whole different financial structure. Like we don't get bonuses, we don't get this, we don't get that. So you have to structure your finances a little bit differently.
Thank you.
Actually, I want to make a comment, and also I have a question for the panelists as well. First, I want to acknowledge our leader of this event. This was absolutely one that we don't have. We think we know something, but until you have somebody and hear their experiences, you don't know. So my question to the panelists, to the two ladies who've gone through this journey, could you mentally prepare yourself for it? How do you mentally prepare for it? What can you do?
Let's see, acupuncture, meditation, massages, counseling. No, I'm not just kidding. But really it was a trial and error. So throughout the process, there were different things that I had to really uncover for myself. But it's good to have a partner in the process. So though it was emotionally taxing, it was stressful, and I may have had a bad day for 1 week or whatever, and then my husband may have another bad day. So we have to balance each other out and make sure that even as individuals, we're doing the things that we need to do to maintain our sanity, because it definitely weighs heavy.
I think for me, with the egg freezing, it just became taxing on the body for me. And that was a lot. And I think I had friends who just did like an IVF process, so she kind of warned me, but I was like, she playing his somehow. But it was taxing because it's draining. Like I would take my medicine like around like 6 o'clock at night, and by 7 I'm in the bed ready to go to bed because it was just that much of a taxing journey for me. So mentally, like you said, just having some different outlets to really help you get through the process. It's a lot, but it also ends quickly, so it's like a 2-week process. You'll get through it quickly, but it'll seem like it's a long journey.
We have one last question.
Okay.
Hello, hi, my name is Vicki. I have 2 young daughters. They're 22 and 24. My 24-year-old, she's an entrepreneur. She's the one who goes back and forth with, I want to start having a kid at this age, but then she's like, oh no, I don't want kids right now. I'm gonna wait later, I have things to do. When you mentioned about starting early on consideration of freezing your eggs, how young do you mean by starting early? Are you talking in their 20s?
Well, you could start early, but again, so meaning like in your like 20, right, 18, if someone had cancer, they could start even earlier than that, right? The issue is you don't want to invest in something that you're never going to use, right? So the earlier you do it, that becomes the risk. But if you invest early, if you need them, those eggs will egg. So at 24, if someone is, you know, in a financial position, if mom's gifting them an egg shower, maybe, you know, it's not a bad thing to consider to do. But again, everyone has their own journeys. Some people are higher risk of starting their families later. An entrepreneur would be one of them. Medical professionals, one of them. Legal professionals, yeah, these people, they make us go to school forever, you know? Or you're an entrepreneur and it takes a long time to really see the returns that you're putting into your career baby, right? And so it's not something that you don't have to think about. 24 is not too young to freeze eggs, you know, in a scientific standpoint. But, you know, someone has to really make a decision. Is it going to be worth it financially, physically, mentally? Do they reassess again? At least getting the numbers like the AMH would be helpful just so they know where they are. But if you freeze it at 24, those 24-year-old eggs are the best eggs.
Thank you all for your questions. I think that everyone learned a lot here today. As we close, I just want to add that one of the reasons why we have this event is because we know a lot of women, specifically Black women, who are climbing the corporate ladder, right? Or entrepreneurs, they're going after career. And from a statistic perspective, a lot of these women are not having children right now. Are not even married, and they're not even having children. And one of the things that is key, I think, is environment, what we're told, the stories that we're told when we're younger. They teach you how not to get pregnant, but they don't teach you about family planning. So we want to have this conversation so that people can really spread the word that, yeah, you can think about your career, but you can also think about your family, right? You can think about your future family. And even if you're not ready, you can make decisions ahead of time to prepare yourself for your future family. And again, a lot of our counterparts, they do it at the same time, right? They go to college, they're getting married right out of college, they're having babies at 22, 23, 24. And I think that from again, just a socioeconomic status and from our history, we're trying to focus on careers. We're trying to get rid of those generational curses that we have. So because of that, we're forgetting about something that is truly really important to a lot of people, which is family planning. So that's why we had this event today. As we close, I do want to ask the panelists one last question. Based on everything that we discussed here, can you give any last minute tips on women who want to have it all so that they can actually do that? And also, can you provide information if anyone here wants to contact you or ask you any different questions or maybe want to seek fertility treatment?
I would say, I feel like women can have it all, you might just can't have it all at the same time. And so if that's something that you want, never stop going for what you want. You can definitely have it, it just may not be at that same time that you want to have it all, but you can have whatever your heart desires whenever the time is right.
I think planning, understanding that we have a biological clock, just like you save for your finances, think about saving for your future fertility, whether that's just getting an assessment or freezing eggs or becoming a single mom or whatever it is. I think that you don't get in a position like most of the people in this room without really having foresight about what you want your life to be and really being goal oriented. Part of that is looking at what you want from a family standpoint as well.
So you may not be able to have it all at the same time, but I would encourage you to do many things at the same time. Because as you mentioned earlier, many women in other cultures are doing that. So they're working through their career and having babies or being married or things of that sort. So just, re-emphasizing that as we continue to keep our minds on the biological clock, and life is short. What can we do now, whether that means working on the career and working on, your journey to conceiving. But on that journey to conceiving, I would like to say for anyone out there that is trying to just remain open. Because as I went into it, as I said, it was trial and error, things that I didn't know, things started to open up and I had to be flexible. But in that, though it seemed stressful, though it may have seemed like doors were closing, I had to remind myself that maybe this was a reason behind this. Mortality rates are high for Black women as well, so maybe this was something to protect me. So think through things in that way instead of why me, but what can I do to make this a situation, an outcome that I want to see?
So what I will say very, very quickly is that I think there is an opportunity to have all, but I want to say that we should probably lean into evolution, that in different seasons and different parts of our life, what that all looks like is going to change and be very different. There's an all that I thought I wanted to have when I was 18 that was very different than the 28 me, the 38 me, and the 42-year-old me. So I think embracing the evolution of what all happens to look like and be is going to be something you want to lean into. So if it's not, I'm supposed to be married by 30, or I'm supposed to have a baby by 35, those things can change and be different. But understand that whatever is supposed to be your journey, God is going to lead you along that path. And so with that, thank you all for coming. Thank you for this panelist group. If you want to follow me, you can follow me on IG, Brandy Speaks 247. Thank you. Brandy out.